Hello everyone, once again welcome to my IT channel. It's been a long time I didn't post any new videos regarding OIT because of the time shortage. Anyway, I'm back, so I will give you a few tips to get B score in your OIT writing and speaking. So I will give you brief explanation of the suggestions or my tips or what I can tell you some of the small things which you can keep it in your mind when you are practicing for your OET exam. So I will start from the beginning. Example, if you are a beginner or you are in the state of like the next step of exam, whatever, just analyze your mind. Okay, so what you know or what you aware about the exam. Okay, how you are going to approach the exam. So as you know that we have 4 modules, and in every month we have 2 exam dates are available. One is only for nurses and another one is for general, like common medical profession. It includes doctors, nurses, physiotherapist, pharmacist, occupational therapist, and so on. So, if you take the exam, it's my suggestion. Okay, so it's only like it's from my mind. If you take the exam for all, like the exam which is intended for all medical profession, especially for listening and reading, you might get questions out of nursing, but it is including medical. So you may have some difficulty to find the answers. Sometimes it may be like a general, so it will not be like a specific to nursing topics or like a specific our nursing task. So it is always preferred or preferable to take the exam date which is only for nurses. So writing and speaking, almost everywhere you will get like similar questions, so there will not be any issue. But for listening and reading, I suggest to take the exam is intended only for the nurses, like the date which is intended only for the nursing profession. That is the one thing you have to keep it in your mind when you take OET exam date. Another one, when you have to take the exam date. So like some students used to book the date first and then start studying. So for me it's not a good idea to book the date, I mean book the exam and start studying, because you don't know how much you have the capacity to get the knowledge of OET and how to set for the exam. So it might take like from 3 months to like 1 year. It's up to your time, your knowledge, and your the life, even the life situation. Because if you are engaged with the family, if you're engaged with your work, for some of you have 12-hour shift, 8-hour shift, or it's just like a complete week you have duty and the next week you will have off. So it depends upon your duty roster and the area where you work and the country, even the country where you work. So whatever, you have to think about your duty roster, you have to think about your family. Some of them you have kids, and it is very like stressful to have work like balance with the studies. So you have to set a time period to study thoroughly what is OET and how to crack the OET at first attempt. Okay, so don't think that I can have a retry, or maybe I will take the second or third exam dates, so I can like at least in any of the exam dates I could finish my scorings and all. So don't think about that. Just think about one exam. Okay, in the first exam itself, just try to get past. And in case if you didn't get in the first chance or second chance or third chance, maybe if you are thinking about the next chance, it's okay, fine, but don't rush to take the exam date. So set time, and because it's 4 modules, it's not single module. 4 modules are 4 different types, and if you study all together it will be very clumsy in your brain. So set a time for listening and reading separate, writing and speaking separate, because speaking it is at least it's like it's not like more time consuming, so you can balance with the writing. Listening is not a much time consuming as in comparison with reading, so you can balance these two. So don't try to study all 4 modules together. Just to keep time, for example, for 2 weeks for writing and speaking and the next 2 weeks for listening and reading. So in a balanced way you can just go through these modules. that's also one of my suggestion. Okay, so don't mix up everything in your mind with OET. And if you are a student only focusing on OET, it's not a matter. You can concentrate on 4 modules. It's not a big thing, because you are concentrating only on OET studies, not with your other like work. So it's okay, fine for the students, okay, those who are dedicating the time only for IT. And the next thing, from where to start, where to end, how to calculate the things, how to prepare the things properly. So some tutors, they may help you how to like set the timetable, how to study the things. But few of the students, they don't have any idea, because some tutors, they will handle only like they're assigned to works. So maybe you will not get any help for the timetable. So you are the one how to sit and do the timetable for yourself according to your time and everything. But you have to prioritize the recent exam questions. Okay, so writing and speaking, in OET, like in YouTube's and OET other channels, you could find out like recent exam questions. Just concentrate on those questions. Like if you're going to my YouTube channel, you can see the playlist recent exam questions. So you can just go through that and you will get clear idea how is the pattern of exam questions. The same way speaking also, you can go to like in YouTube itself, you can just try, you can just type recent OET exam speaking cards. So of course you may get many cards. So those cards, it will be beneficial for you to give you a clear picture how is the pattern of exam. Okay, listening and reading, I'm not allowing to go through such a way, because we could not expect what type of questions may arrive. So you can practice all type of reading and all type of listening questions. One of my advices is, don't stuck in one YouTube channel, because you may have like the similar pattern of um, like the slang or the voice, so it will be similar and you will not get any other slang, means it will not be beneficial for your exam. So what is my suggestion? You can search different YouTube channels and different like Slack, like Asian, like Indian, American, British, Irish, Australian. So everyone's slang is different. So you have to be familiar with all those slangs. Okay. In case, example, paracetamol. So how we pronounce it's paracetamol. In some countries, it is totally different. We could not understand that is paracetamol, but when you go to the key answer, you could see that that is paracetamol. It's a simple word. I couldn't understand what's that. So this is a thing, it's happened for me also when I start studying OET. That's why I'm just giving you the suggestion. Don't stuck with one YouTube channel or any other specific channel for listening. Go through wherever you can find out like proper material, but it should be the same. Okay, 2 point, it should be like 2.0 version. You have to follow the current version always, and just be familiar with the different voices, like younger, older, like middle age, then male, female, then Asian, as I told you, different country. So these all slangs you have to be familiar with. Even like if you are taking female, the younger, older, middle, even though there will be the speed of the conversation, it is totally different. Some are very fast talker, some are very slow, some are harsh talker, you could not find out what they are pronouncing. Some of them, they will act in pain and they will talk. So if they are in pain, of course the sound, it will not be clear, you will not get a clarity of the answer. So these everything you have to keep it in your mind. And especially those who are writing exam like internationally in European countries, as you know that in some centers they don't provide the headset for listening. So you will be in a room with 15 or 10 or 15 members. So in case if you are a friend, those who are sitting nearby, if they cough or sneeze, or if they make any noise, your concentration will be off, so you cannot concentrate properly. So in such situations you have to be practice, or you have to practice without headset. Okay, so if you take exam date in such centers, if you know that they will not provide headset, of course you have to practice without headset. So that is important one. The other thing, always practice in the answer sheet. So the answer sheet of like OET answer sheet, it is available in Google. You can type and you can get the printout, and just practice by answering in that. Okay, so Three modules you have to practice in such a way. Like writing, there is a pre-writing answer sheet. Most of the students, they don't know that at the end of the booklet there is one empty page, so it is like without lines. There you can write. Okay, it's for your rough usage, like if you want to try any spelling example. Like even me, many times I experience when we write, especially reading and listening, when we write we will stuck with the spelling. Of course it might be the like a very familiar sentence or very familiar word, but we'll stuck with the sentences, especially AE, if it comes together. Okay, so for that, the last page you can use, like you can just write, and later maybe if you want to confirm or if you want to keep some notes to remember, you can keep it there. Okay, that's the last page of the answer sheet. So you have to search in the Google Oet answer sheet or booklet, like writing booklet, listening or reading, something like that. So it will be there. You can download and you can have it. And writing, of course, minimum 5 letters you have to practice in that answer sheet. Why? Because you have to know the size of your words, the letters. Okay, and like the count, like 180 to 200 words should be there in your letter. That means it should not be going below 180 or it should not beyond 210. So maximum 210 words are okay, but during exam evaluation they are not going to count the words. Okay, so many of you are thinking that they will count each and every word. It's not like that. It is easy way. You can just count your lines. Okay, from introduction till the recommendation, you can just count the lines, how many lines you wrote, and in each line no need to count completely. Just take one particular line and count how many words are there. Most probably you may have 5 or 6, maximum 7 words. So you can count complete lines, multiply it into 6 or 7. Okay, so if you are writing and practicing only, you will come to know that in one line how many words may come, like 5, 6 or 7. So like why I'm telling you to practice in such a way. Example, for me, if I write the first page completely, I have to turn, and the second page, I like one by fourth. If I write, my letter completes with 180 words, maximum 200 words. Okay, so that I know, if I write till there, it become like 200 words. I should not write beyond that. So it is there in my mind. So I know that I have to be careful when writing the letters, so that you can just consume the time by counting all those things. This is unnecessary wastaging of time. Okay, when you are writing your letter in your exam. So it is a good thing that like a dates, example 18 November 2024. So 18 November, then some used to write 2024 in the second next line. So it's wrong thing. So if you practice in such a way, you will come to know that so what is wrong, what is right. Example, if you write your letter and if you send to your tutor, she or he might correct it. So it is wrong thing. You should not write like that. But if you're practicing in a small book, of course you could not compare these things. Okay, so it is better you can just get download and take a print out, 3 or 4, minimum 3 or 4, and just practice in that paper, and you can just analyze yourself. Okay, especially the caps locks, the hyphenated word should not be there, the date should be completely in the same single line. Then Parkinson disease, like which condition named with the professor's or doctor's name, it should not be like splitted into 2 lines. It should be in the single line, and the first letter should be caps lock. So these everything you can practice in the original paper, so it is easy for you to remember the things. Okay, and a paragraph organization also you can easily find out, so where I have to make it short. So some of you may have the doubt that how many paragraphs should be there, like how many lines in a paragraph, something like that. Paragraphs, actually introduction should be there, then the present medical paragraph can be 2. Okay, maximum 2. I always suggest my students to write a present medical paragraph into 2, like it is like organized way, so it is easy for you to get B score. I will tell you in detail. Then the social paragraph. The social paragraph means past medical history and personal history will come. The personal history you can write start in the first, or the past medical history you can write, but the personal history should be together. then the medical history should be together in the single sentence. I mean, single paragraph. Okay, example, if you write, Mr. George is married and has 2 children. He lives with his wife in a retirement village or something. He smokes 20 cigarettes per day and consumes 3 to 4 glasses of wine per day, something like that. These all comes under the personal history. Then you have to write medically, comma, he has had hypertension since, something like that. Okay, so all medical histories you can write there. It should be together. It should not mix each other. Like some used to write, Mr. George is married and lives with his wife. Then he has had hypertension since 2020 and is on Ramipril. Then again, he consumes, something like that, mixed up. You got the point. So it should not be combined manner. It should be like a separate. Okay, separate means in the single paragraph itself, the present medical, the personal history and the past medical history should be segregated. Then the recommendation paragraph. So recommendation paragraph, how to be concise manner and maximum try to avoid multiple sentences. Like in lengthy sentences, you can make like a lengthy sentences, 2 or 3 recommendations. You can write it in the single sentence. That is, complex sentences can be created, but without any mistakes. Okay, so it should be in like a polite manner. In Oet letter writing, you should avoid like should, you might, you have to, you need to, these things and all. It's like a demanding, so you have to avoid all those things. So instead you can write please, kindly, it would be appreciated, and like please not, kindly not, it is worthy to not. So these phrases and all, you can use it there. So these are all the like a paragraph. There is no rule that in single paragraph how many lines should be there. It's up to you. Okay, present medical paragraph, as I told you, maximum it can be 2, but it should be in a specific manner. I will give you some tips. Example, if the patient had hospitalization, then you are writing about home visit. If it is not urgent, referral letter to emergency department. You can start from hospitalization, okay, the old history. Then you can come to the home visit. And old histories, everything can be in one paragraph, and home visit can be in a different paragraph. The another one scenario, if today's home visit is very much important, you notified more things and you have to elaborate the things, means the old things, everything can be in a single paragraph, and today what happened, it can be in the next paragraph. Okay, and you have nothing like segregation, only one scenario that happened when he came or she came to your clinic, something like that, means you have to think, okay, how you can divide the paragraph. Similar things can be together, similar things can be in the next paragraph. Example, if he came and admitted in the hospital with the clinical features, what are the signs and symptoms and what are the diagnostic tests did. In the next paragraph, you can write about all management, but still he or she needs further referral to your service. Those things can be in the next paragraph. Okay, so you have to think how to divide the paragraph in the present medical thing. So what I notice in my students' case, like mostly from 2020, like 2021 until now, they are concentrating mainly on present medical paragraph. Okay, so if your present medical paragraph, the organization, it is wrong or it's not good thing, you may miss B score. So you can score like C plus, but of course even the C plus, it depends upon the organization of your letter, especially in the present medical paragraph. Okay, so always try to see the recent exam questions in YouTube's. So if you want to see many question and plus answer, you can see my YouTube channel also, but go to playlist. Go to the playlist and you can see recent exam questions with answers. Okay, so you can see simple letters. So my letters are simple thing. I didn't use any complex sentences or difficult sentences, but it is very simple. You can just read and you can understand how his organization is going. Okay, you can write your letter by your own, then you can compare with any of such letters, so you can come to know how to modify the sentences or how to write it in the passive voice and all. Okay, the another one more important tip I just want to give. It's a simple tip in every Oet letter, whatever the letter, it can be discharge letter or transfer letter or whatever the thing. At the end of the present medical paragraph, just keep one small sentence. Okay, something you wrote everything. like the last sentence maybe like he has progress. Okay, he made progress or something, but just avoid the term good progress. Okay, you can just write progress. Then simple sentence you can write comma, however, comma, further attention from your service or at your facility is essential for his or her well-being. This is the reason for his or her referral. This is a simple sentence you can by heart and you can write it in your all letters. Okay, it gives much meaning for referral. So whatever the progress it's made, it has been there, but still we need to refer this person to your service for further recovery or further like treatment or further well-being. Okay, so it is just like a closing of present medical paragraph, and like exactly kindly we are like requesting your further attention for his or her well-being. Okay, so this is a simple sentence, but this makes totally different like perception in like the evaluator's mind. Okay, so this is known as organization, or this is known as the way of writing letters. Okay, and another one more thing, suspected cases. In case if you have a suspected diagnosis in present medical paragraph, after writing all clinical features, just mention, okay, after writing all clinical features, just continue it, which aroused the doubt of his or her possible, or his or her, it is a suspected case, right? So which aroused the doubt of his or a possible diagnosis. Don't write confirmatory diagnosis, possible diagnosis, full stop. Therefore further attention from your service is essential for his or her well-being. Okay, this is for suspected cases. Whatever the suspected cases, if it comes with a query like like example like esophageal viruses or something, if it is with a question mark, so that is a suspected case. Possible ovarian cancer, so this is a suspected cases. Okay, it's possible, suspected, query, these all comes under not confirmatory diagnosis. So you have to write which aroused the doubt of his possible diagnosis. Therefore further attention from your service is essential for his or her well-being. So like that you can just close the present medical paragraph, but don't repeat the same sentence in your introduction or in the recommendation. Okay, so you have to make sure don't repeat the sentences, don't repeat the same sentences in different paragraph. Then some used to ask the doubt that whether you can repeat the connectives. You can repeat the connectives in different paragraph, not the same paragraph. Okay, example, if you wrote however in present medical paragraph, you can write the however in social paragraph, no issue, or in recommendation paragraph, no problem. But you should not repeat the same in the single sentences. Okay, and if you're writing like the present medical paragraph, the first paragraph you wrote even though, but in the same present medical paragraph in the next paragraph don't write. Okay, don't repeat it, because both it's same present medical paragraph only. And another one more thing, like so that thus, but in spite of, despite of, furthermore, moreover, these all are removed from OET letter, so don't write it in your letters. And in introduction, don't write the term us. Okay, because before we used to write as like this letter is being referred as Mr. George's cousin's request, somebody's request. So that we used to write before, but now it's not there. But you can use as in any other paragraphs, no problem, except introduction. And in recommendation paragraph, it would be greatly appreciated that greatly, the word has been removed from OET. So don't use that word great. Then before who, don't use comma in introduction. Before we used to keep comma before who, now it's not there. Okay, so these all changes, it's from 2021, like nearly April. They made more changes in OET writing. So if you go to like updates in OET writing in YouTube, you could see all those updates. So I have a video, so you can see that video also. And if you see my description of this video, you could see all playlist name or specific letters names or like common tips, exam preparation tips, everything you can see. The links are placed in the description. Okay, so you can go through that. And there is one Telegram group also. You can just if you have any questions, you can just ask in that. And if you go to the files in the Telegram group, you could see reason speaking cards and like our 100 plus writing task, reading, listening, practice test, some like a few official videos, Oet official videos. So everything it is posted there, so you could see in the file section also. Okay, it will be benefit for you. Another one more thing regarding writing, there are different types of questions. Some of you might think about the like institutional letters or informative letters. So it's not more, no, it's not there in OET now. It was there before, but it is not there. Like if you are, there is a reference letter to all community people or all parents from school, like the lecturer is supposed to write to many people. Okay, so that is like institutional letters or informative letters are not there. Now we don't have. We have like a referral letter, transfer letter, discharge letter, known case, unknown case. These type of letters only we have. Okay, we don't have like different types of institutional or referral like informative letters and all. So you have to be careful when you are selecting the questions and practice in such a way. And if you have any difficulty to practice, so you can join with my online academy. So I have few expert tutors, those who handle letter corrections very perfectly. All they follow, I feel all they follow my same pattern, so you can trust with them. And if you have time limitations, we can provide flexible schedule as well. So you can talk with your tutor and you can fix the timetable. And after 15 section you will have the mock test with me, so I can give you few corrections as well. So these all are for writing. And regarding speaking, actually speaking module, it is a simple, but it is easiest one. I can tell that it is easiest module among all other 4 modules. And if you see my Telegram group, in the file section you can see all recent, like most of the recent exam questions are there, and you can practice all those as much as possible. There are few criteria how you can practice. Always try to practice many speaking cards where the mother's interactions, like the nurse mother topic, because you might have more difficulties or more mistakes while talking to parents. Sympathy should be there, sympathy, empathy, and you are talking regarding someone else, not the direct person, right? So there may be more grammar mistakes, so you have to practice more that cards, those type of cards. The next one is the community's introduction is totally different. Like you are not like straight away starting the thing, so you have to ask there, you have to introduce yourself, and you have to get confirmed the resident, I mean the patient, and you have to ask the permission. Then you have to go to the topic, so that is different. The same thing, non-case, the non-case scenario also, you already started the conversation, so you should not give your name in the starting, you should not ask their name during the conversation. So these things you have to keep it in mind. And if you could take out a printout, it is better. You can keep printout, write the 11 points in the paper, underline the things, and you can put the question mark wherever you want to ask, like do you have any other concern, such questions. Okay, so everywhere you could not ask questions. Wherever the specifically you have to ask, you can just put a tick question mark. Everything you have to practice at home. Okay, don't try to do the things in front of the examiner. Everything have to be prepared in your mind, whatever the thing, because the examiners are not same. Some are very cooperative, especially if you're writing exam in like Europe's, you are speaking examiners, of course they will be more motivative, or they will be more cooperative. But other countries we could not expect in such a way. Okay, so everywhere we have different examiners. I'm not telling that in Europe's everybody are very welcoming, but you can compare it with the other countries and all, it will be different. Okay, so even in Middle East we could find like few examiners, like they used to support, but they are strict. Like in India also the same way, few are supportive, few are difficult, so we could not expect the things. So don't think about the examiner's attitude or the behavior or the communication, the supportive, the time, everything. You have to keep it in your mind. You have to set your mind. You have to practice in your own thing. Whatever the examiner's like reactions, you have to maintain your own tones. Okay. These things, once if you practice, everything will come. And few things you can keep it in your mind: how to start the conversation, how to end the conversation, how to go with the flow, what are the sympathetic and empathetical words, and how we can close each sentences also. How does that sound? Are you okay with that? Are you getting my point? So these phrases or these sentences you have to by heart it. You should not repeat those sentences. Okay. So by practicing only, everything will be everything you can just fixed in your mind. So the thing is, you can keep a speaking partner. It can be your spouse or your relative, your friends, or you can find someone in groups, your own study groups, like WhatsApp groups, or in my Telegram group also. You can just request if there is there even anyone available according to the country. Okay, if you are in Middle East and someone in India, it's difficult. If you are in Europe and someone in India, the time zone, it is like more than five and I mean 5.5. So there are more hours differences. So you can just prefer those who are in your own zone, country zone, the time zone. Okay, so it will be benefit for you. And most of the time, the time issue, mostly everyone they are working in different shifts, so it is difficult. So in such situation, if you don't have anyone to practice, you can just record your conversation, but you have to listen yourself. Okay, so you have to listen and you have to understand what is the difference, whether you are repeating anything same words, or are you in hurry way, or the time if it is not in the correct time, everything. And if you are a fresher, don't keep 5 minutes for speaking. Just practice by yourself. Don't keep any time to keep the thing. But when if you're approaching your exam, of course you can keep the timer. Okay, the 5 minutes timer, and can do. Warm-up questions are in my YouTube channel. Easy questions. They will not ask like very tough questions. It's always repeated questions. So you can just see my YouTube also, or in YouTube if you type warm-ups, many topics will be there. So you can just write and practice. Okay, so don't listen, just write and practice yourself, because no need to by heart it. You can add your own things. Okay. Then in speaking, how to start the conversation, how to end the conversation, I have two separate videos because we have many scenarios, so everything I summarized in that. If you see the common tips in my YouTube channel playlist, even the speaking it's there added, so you can see that. And many recent exam questions, instructions are there how to practice. So if you want to see, you can see there as well. And if you want some assistance for speaking, if you need the guide, it's available for writing and speaking. Writing is 300 Indian rupees. Inside India, we can send by courier by free, but outside India, the courier charge it is we could not afford it. It's very high. But if you have any friends in vacation, I mean in India, so you can message me, WhatsApp me, and I can arrange that as well. So in that writing guide, it is 1.4 kg weight. You have 100 plus questions and answers. Few like A to Z letter writing things are there. Some OET grammar tips are there, important grammar tips. Then you can see 75 recent exam questions and 25 plus all type of questions plus answers. So if you don't have time for online classes, it would be beneficial for you. You can see the questions and can see the answers as well, and you can compare your letter with those letters. Speaking guide actually it comes with the USB, and there are few speaking recommendations, some basic videos, and 60. You will have the guide with 100 questions, recent exam questions. 60, the first 60 questions answers how to present. It's there in the USB as a audio. Okay, so it is easy for you to listen and understand how you can practice it. So you can use that guide to practice with someone else. So that's the speaking. And if you want speaking guide, if you want to send through like online, like through any way. We can send it through Google Drive. It's okay, fine, we can do that. But writing guide we could not send as a PDF, so it had to be hard copy. Okay, so if you need guides, just WhatsApp me. The number is there in the description, and you can contact in that. And if you want to join for any module, writing, speaking, listening, and reading, you can message as well. I will give you the fee details and other informations and everything. The classes are totally individual. It is individual, like 1:1. There is no Zoom classes, no like combined classes. Everything is individual classes. All materials will be provided after payment. There is a like a Drive link. You can just open and you can see all basic videos and all materials if you join for writing and speaking. Also, if you join for all modules, I will send the single link, the same link. You will get access for all 4 modules. You can download it, you can print it, you can practice it, whatever the thing. Okay, so recent exam questions for writing, speaking, authentic materials for reading, listening will be provided. So you can just practice with your tutors. For writing, I have specific questions. I used to tell to my tutors to practice those questions. Those are important. The same pattern you can expect in your exam. Okay, so they will teach you those questions plus additional as your preferences, like important things or hard questions or whatever. Speaking, I have few like guidelines, like homicide, concern, parents concern, community health center, procedure, exams like surgery preparations, explanation of any BP, like self-administration of medication, self-administration of injections, or self-monitoring like blood glucose or blood BP monitoring, something like that. So related to procedure, you can expect some questions and non-questions. These all are categorization in Oet speaking. So these are everything. Listening, reading, during class, the tutors, they will explain you how to find the answers. Okay, they will give you the tips how to get the answers correctly and how to manage the time, everything. So if you need any assistance, you can just WhatsApp me and I will give you all other informations. So I hope I have included every tips and suggestions of writing, speaking, and writing. And if you have any questions, you can just send message, I mean, in the chat, or you can WhatsApp me, or you can just pop message in the Telegram as well. So every links are given in the description, don't miss that. And if you need any assistance or regarding the like exam preparation or any other thing related to Oet, anytime you can message me. Okay, so we will see with another one informative video. Until then, bye, take care.